Marek's disease can be a scary word for somebody with a chicken flock. We're going to go over a few of these misconceptions and help you keep your flock safe. The virus involved in Marek's disease is very common and affects chickens and turkeys in every part of the world. The tumor-causing virus varies in its pathogenicity, but once infected, the chicken carries the virus for its entire life. Vaccines are available in vials with a high number of doses intended for commercial farming use, and this vaccine is very effective in preventing clinical signs from developing. However, the vaccine does not stop the chicken from becoming infected with the virus, or even transmitting the viral particles to other birds in the flock. Marek's disease can take a variety of forms and presents with a range of clinical signs and lesions. The classical form of Marek's disease is its neurological form. This form is lymphoid cells infiltrating the peripheral nerves, and depending on what nerves are affected, the clinical signs can vary. Infected nerves in the cranial region can cause dilation of the crop, respiratory signs, wry neck, flaccid neck paralysis, as well as the classical lameness that you see in many cases. These are the most common presentations, and mortality occurs in about 20 to 30% of cases on average. Transitory paralysis is due to infection and edema around the brain. Full paralysis of the neck or legs are typical clinical signs which last 2 to 3 days. Affected birds may require assisted feeding to fully recover. The ocular form involves a color or shape change to the eye, as lymphoid cells alter the iris color, change the pupil size, as well as cause a variety of blindnesses. This form is rare and usually occurs in older birds. The cutaneous form of Marek's disease is seen as enlarged feather follicles grouped around the legs and lower body. The visceral form has tumors that form on the internal organs. Clinical signs vary depending on which organs are affected. The virus is shed from skin and feather cells and is inhaled by other chickens. Being a herpes virus, it tends to be transported to cutaneous sites such as the skin or feathers. The virus in the feathers and skin dander can remain infected for up to 8 months, making this a very difficult virus to manage. Risk factors such as stress, injuries, moulting, and egg production can produce immune suppression. This is when Marek's virus can reactivate and clinical signs can manifest. Typically, clinical signs are seen in unvaccinated birds between the ages of 6 and 30 weeks, but older birds have been known to have symptoms. Vaccinated birds rarely get sick, as the vaccine is typically given at a day of age. The vaccine only prevents clinical signs, but does not stop the bird from being infected or passing the virus onto unvaccinated birds. So, what can I do? Decreasing stress is the key. In older birds, issues typically present during the molt or when coming into lay, but other issues such as extreme heat or cold and possibly a concurrent infection can allow Marek's virus to have more of an effect. Be aware that vaccinated birds mixing with unvaccinated ones can still pose a risk. Keeping a closed flock, where no new birds are added to your current flock, can be an effective way of controlling Marek's. If you really liked our video, please like and subscribe.